My name is Kate Fisch. I'm the Associate Vice President of Clinical Services for the Odyssey Eating Disorder Network, and that includes the Toledo Center for Eating Disorders. So when we think about the treatment approach for eating disorders, we think about it in a step-down model. And so I want you to imagine that there is a staircase with 5 steps. And at the top of that staircase is the step of inpatient treatment. Then we're going to step down to residential level of care. Then we step down to partial hospital level of care. We will then step down to intensive outpatient level of care, and then out to your outpatient treatment team providers. And I'm going to break down those levels of care a little bit. So when we think about the highest level of care, inpatient level of care, we're thinking about more of a hospital setting. We're thinking about a client who has some medical acuity, who is not medically stable and needs 24-hour-a-day medical supervision and monitoring. The residential level of care is still 24-hour, 7-day-a-week monitoring, but it is not always in the hospital setting. Here at Toledo Center, for example, this is our highest level of care, the residential level. And this is an opportunity where we can really begin weight restoration and begin the rehabilitative process with food. So where the inpatient level of care is focused on medical stabilization, the residential level of care is focused on weight restoration, continued medical stabilization, and getting into a place cognitively where we can start to do some of that therapeutic work. Which takes us to the next step, which is the partial hospital program level of care, or PHP. This level of care, which we offer as well at Toledo Center, is where we really get to dig in clinically, where we really get to explore what the purpose of the eating disorder is, because as we all know, eating disorders are not just about food. So how is the eating disorder serving you? We can start to really learn new strategies and coping mechanisms to tolerate what is going on that the eating disorder used to take care of. As we step down into intensive outpatient level of care, our number of hours of programming a week, so our weekly support, decreases significantly. This is an opportunity for our clients to go back home, go back out into the community or their day-to-day lives and practice these skills, start to be able to really infuse their life with the insights that they've made during therapy, and practice living a life of recovery, identifying obstacles, identifying any pitfalls or triggers that they might have, while still having some support before they really step out of the treatment model and maybe back into an outpatient setting. So there was once a week therapy or meeting with a dietitian weekly.